Liver disease often hides in plain sight, but your body might be trying to tell you something. Did you know that your skin, your eyes, or even your breath can be sending you a silent cry from your liver? Well, that's what today's video is about, because knowing how to recognize these silent signals could mean catching your liver disease earlier for you or a loved one, and protecting your health before it's too late. Hi, I'm Dr. Brian. Liver disease doesn't always announce itself. In fact, it's often described as a silent condition, especially early on. This makes it crucial to recognize changes that are in your skin, in your eyes, and other physical features that can be the very first clues. Today, I'm going to explore 7 common findings of liver disease, each of which might be your liver asking for help. Number 1. Scleral icterus and jaundice. Scleral icterus is a fancy long word that means when the white parts of your eyes turn yellow. It's caused by buildup of a special molecule known as bilirubin. Bilirubin is a byproduct of your body breaking down red blood cells, which it does every day. But when the liver function is bad, whether it's due to hepatitis or cirrhosis or even a tumor blocking up bile ducts, bilirubin accumulates in the blood. And after there's so much in the blood, it starts to deposit in tissues. And this leads to yellow discoloration, and it occurs first and most noticeable in the eyes. Scleral icterus can be an early sign of liver disease, and it occurs long before jaundice, which is when the skin itself starts to get yellowish. One interesting side note is that yellow skin is not always liver disease, because there are a number of individuals that eat lots and lots and lots of carrots, sweet potatoes, orange squash, and individuals that eat a lot of those types of vegetables actually will get yellow skin. That's not jaundice, because if you look at the sclera, or the white parts of their eyes, that's still white. The next sign is known as fetor hepaticus. Liver disease can affect more than just the skin. Individuals will have a distinctive musty or sweet odor to their breath. This is known as fetor hepaticus, and in Latin that translates to liver stench, which is pretty accurate. This occurs because the liver, when it's damaged, doesn't filter out toxic substances from the blood. This leads to a buildup of these substances like really pungent sulfur compounds, ammonia, and yes, think the same kind of ammonia that you clean the kitchen with. Those substances can't get out through the liver, so they start to escape through the lungs as a gas. The next unusual sign of liver disease is what's known as gynecomastia. This is enlargement of breast tissue, but gynecomastia, or the development of breast tissue in men, is a very common finding in liver disease. It's thought to be because of hormonal imbalances. The liver normally helps to metabolize and clear hormones, especially sex hormones like estrogen. In liver disease, estrogen levels can rise, and this can lead again to development of what looks like breast tissue in men. The next finding is spider angiomas. Now, spider angiomas are vascular lesions, that is, from blood vessels. If you look at them, they consist of a central, very red blood vessel with tiny little threads of blood vessels on the periphery leading out from that center. Those are little capillaries, and they appear on the face and neck and the chest, and they look like little spider webs or spider legs, and so it's known as spider angioma. Spider angiomas are also thought to occur because of increase or imbalance of some of the hormones. Again, estrogen is probably the reason that they develop, because the liver is unable to properly metabolize it. A few spider angiomas may appear in healthy individuals, particularly pregnant women. The presence of 5 or more is often considered a real level of concern and a reason to look for things like liver disease or cirrhosis. The next finding, which is a little bit more obvious than some of the others, is known as ascites. Somebody who has ascites, which is the accumulation of fluid in the abdominal cavity, will have a distended abdomen, and this accumulation of fluid is secondary to liver damage, and the liver damage leads to increased pressure in the veins that supply the liver. This is known as portal hypertension, and the liver damage also will decrease the production of an important protein known as albumin. So this increased pressure, the decrease in the amount of protein, allows fluid to literally leak out of the blood vessels, and it accumulates in the abdominal cavity. A very common procedure for individuals with liver disease is what's known as a paracentesis, where you oftentimes use ultrasound, a small catheter, and a needle to pull fluid out of that abdominal cavity. I have seen individuals who have had as much as 12 liters of fluid in their abdominal cavity. The next finding for liver disease is really quite striking. It is known as Caput medusae. If you go back to Greek mythology and you think about Medusa's head, all the snakes on her head, that's Caput medusae. When you have very bad liver disease, again, there's high blood pressure in the veins that are going to the liver, and the liver is really blocking up the normal flow. When that happens, your body works very hard to drain that blood, which is coming from the intestines, somewhere. And that somewhere else is very commonly superficially, out onto the skin, and around the belly button. And so there can be this very complex network of veins that is very evident, very visible on the skin and surrounding the belly button. And this is really a red flag that the liver is struggling to function properly. The final sign for underlying liver disease is known as Palmar erythema. Palmar erythema is characterized by a very symmetric redness of the palms, particularly the base of the fingers and on the edges. This redness is caused, again, by vascular changes, probably secondary to hormonal changes from the liver not metabolizing. And Palmar erythema is not specific for liver disease. It can be caused by things like rheumatoid arthritis or pregnancy, and it can not only occur on the hands, it can also occur on the feet. This redness, or the Palmar erythema, is typically painless, doesn't cause any discomfort, but it can be a reason to think about possible underlying liver disease. So those are just some findings of liver disease that might really help you understand that your liver needs some help. Thanks for watching, and please don't forget to hit subscribe. Try some of these other videos that are about your skin, like cellulitis, and I'll see you next time.